Hi, I'm Dr Anthea Rhodes, your host today on the Kids Health Info podcast here at the Royal Children's Hospital. For the next few episodes, we're going to be talking with a number of our doctors from the emergency department about some of the common things that they see every day downstairs here in our ED. And first up, we're talking about problems with the penis and foreskin, because this can actually be a common reason that kids might end up in ED, and it's one of the most frequently searched topics on our Kids Health Info fact sheets. So joining us today is Dr Bec Hughes, who is one of our emergency department specialists downstairs here at the ED. Welcome, Bec.
Hi, Anthea. It's a pleasure to be here and happy to have my debut on the podcast series talking about this topic.
From the Royal Children's Hospital, Melbourne, this is the Kids Health Info podcast.
You've mentioned that it's actually quite common for people to come in with their kids with trouble with the penis and the foreskin. There's a lot more foreskins around these days than there were perhaps 10, 20 or 30 years ago, and it can wind up with some problems. So tell us a bit about the things you commonly see.
That's really true. So back maybe 40, 50 years ago in Australia, we had about 80% of men in our society were circumcised, and that fashion has really changed. There's not really a lot of medical reasons to be circumcised, and these days we know that about 80% of the boys and men in our community are not circumcised, and so there's a number of different issues, I guess, usually relating to the foreskin that may arise that we might deal with in the ED. The most common ones we see are usually just some pain or irritation around the tip of the penis, and that can be just related to maybe a little bit of irritation from nappies or maybe some soap sud residue, those sort of things. And so often we see parents come in with their children because their child is becoming distressed when they're trying to do a wee, or they've noticed some reddening around that area. That condition is called Balonitis. There's a second condition, similar to Balonitis, but where there's more of an infective process going on. So sometimes we see that irritation at the tip has spread and maybe gone down the shaft of the penis, and maybe there's some pus or more pain involved. And in that case, we would be looking to treat this as an infection. And then I guess the other issues we can see are that sometimes the foreskin, which is, I guess, the glad wrap or the wrinkly skin that covers the penis, if it gets pulled down forcefully, it can actually get stuck. And this sort of constricts the head of the penis, causes swelling, and then it can become very difficult and painful to try and replace that. So we see those children as well.
So a range of different issues.
Lots of different issues that we see, yeah.
All right, so we might go back and talk about each of those in a little bit more detail for parents listening who might have a new baby, a boy, perhaps they're not exactly sure about the foreskin care. And so when it comes to looking after that baby, there might be some questions and some uncertainty about what's normal and what they need to do. So with Balonitis first, you mentioned that is like an infection or inflammation that spreads down the shaft of the penis. So how might a child show up? What sort of things might be signs that that's happening?
Usually just a little bit of reddening around the tip of the penis. There's an area called the urethra, which is where the wee comes out, the wee hole.
Yep, the wee hole. We've got
the wee
that.
hole. And so if you notice that your child maybe they're crying or distressed around when you think they're weeing into the nappy, or you notice that redness, there are some things you can do at home to prevent them coming in. And some of these things would be putting some barrier cream, like just a simple nappy rash cream on the tip, making sure that if your child is in nappies, that you're changing the nappies really regularly so they're not sitting in urine or something that might make it worse. You can even try just putting them in a warm bath and letting them wee into the bath, and that can help as well. And usually if there's no secondary infection and it's just a little bit of local inflammation, it can just settle down in a couple of days without needing to come to the emergency department.
So would this be the type of thing that antibiotics would be needed for? You mentioned it could be like an infection.
That's a really good question. So most of the time we don't need to use antibiotics if it's just some irritation at the tip. If you notice that the redness is actually spreading down the shaft of the penis, or you're seeing pus in the area, that can be a sign that that there's infection as well. And I think that would be a time to either see your local doctor, so maybe a GP or a primary healthcare provider, or if it's really, really distressing or painful, or you think that your child can't pass urine anymore or do a wee, that would be the time to come into the emergency and see us.
Okay, so let's just talk a little bit more about passing urine or doing a wee. How does this swelling of the penis affect that?
If you think of irritation in any part of your body, if you've got a graze on your skin, you don't like to touch that area while it's healing, or sometimes we cover it with a Band-Aid or something. In this case, the tip or the opening where that wee comes out, you can imagine when the urine's passing past that point where it's inflamed, it causes pain, and so often children will hold on and not want to go to the toilet. In general, this isn't such a big deal if they're weeing less, but it does become a problem if they refuse to wee at all, because the back flow of that tract goes into the bladder and up into the kidneys, and the bladder can stretch to a certain point, but we don't want the bladder to overstretch, and that would also cause tummy pain and even more distress. So we really want to try and help your child pass urine before we get to that point.
Great. So perhaps having a warm bath or putting a bit of cream on might be ways to help your baby pass urine if they're having this trouble.
Yeah, and the other things you could do at home is just some simple pain relief. So things you might have in the cupboard like paracetamol or ibuprofen.
Great. So moving then on to retraction of the foreskin. So you mentioned this can be another reason why young children or perhaps teenagers might end up in ED with a spot of trouble. Can you give some examples and perhaps a bit of advice as to how you could avoid this happening?
So when an infant is born, if they're not circumcised, about 99% of the penis's foreskins do not retract, and that's very normal. If you're in that 1%, that is fine as well. Everything is still normal, but for the vast majority of cases, the foreskin won't retract, and it becomes more and more retractable as that child ages. So by the time children are around 10, it's about 50-50%. Some children's retract, some don't, and then by the end of puberty, about 99% of them do retract. So there's lots of variation moving through childhood. And the most important thing is that you're not trying to forcibly retract that foreskin. So most little boys will explore that part of their body just like any other part of their body.
Absolutely.
And most children will work out for themselves when their foreskin starts to retract, and you probably notice it at bath time.
You've talked a bit about retracting the foreskin. Can you explain exactly what you mean by that?
So it's almost like a double layer that's attached to the penis through little connections. And so as the child ages, these little connections break down, and that means that the foreskin is able to be pulled back, I guess uncovered more, so that it falls down towards the base of the penis. And that's what I mean when I'm referring to as the foreskin is retractable, or that it's retracting. And so if you found that your child's foreskin is retractable, you can wash that area with some gentle soap, and just the same as you would wash any other part of the body. You just need to make sure that you replace the foreskin after you've done it, so that the foreskin once again covers the head of the penis. I mentioned before there's a condition where if the foreskin is left down, then that can cause swelling and pain, and if the swelling becomes too much, actually the foreskin gets stuck and it can't come over the top. This is actually a medical emergency, and if this happens or you're worried this might be a problem, we want you to come straight into the emergency department so that we can help that foreskin get replaced quickly.
Okay, and what makes that an emergency? What is it about that that's so serious?
So if the foreskin gets stuck down and the swelling continues, it can actually cut off the blood supply. So we need to be really careful. Most of the time we can do this really safely in the emergency department with lots of really strong pain relief and maybe some sedation. Occasionally we need the help from some specialists. But if we run into real trouble, it would be an operation.
Really important to know when those things are really urgent and reasons to absolutely come into ED. I can imagine there's lots of parents at home who might have been a bit unsure about exactly which parts they have to clean and just how much when it comes to the penis, particularly with a new baby or a younger child. Have you seen any situations where that's wound up in a bit of trouble?
Yeah, unfortunately we have, and that's why I think podcasts like this are so important, so we can get this messaging out. We really just want you to treat the penis and the foreskin as any other part of the body. Obviously, it's a sensitive area, so if you're washing it with soap, just making sure that you rinse it really thoroughly because it can get a bit inflamed, and not pushing that foreskin back if it's not yet retractable and it feels tight, or your child looks distressed when you're trying to pull it back. That means that it doesn't need to be pulled back. I did see one case in the emergency where the parents felt terrible because they had noticed that under the foreskin they could see these little yellow areas, almost like little growths. It's called smegma. It's really normal. It's just a collection of skin cells that can build up.
Those lumps that look a bit cheesy.
Yeah, it looks a little bit cheesy. It's nothing to worry about. But Mum was worried that there was some pus or an infection under the skin, which you can imagine why she would think that. It does kind of look like that. And she tried to pull the foreskin back and put a little cotton bud in to remove it. And unfortunately, the foreskin had become stuck. And then the head of the penis swelled and she had to bring her son in for us to replace the foreskin back under some sedation. So, I mean, it all ended up fine, but most of the different things that we see on the penis are actually a variation of normal.
Another thing that I've seen once in the emergency department a long time ago when I was working down there was actually a zipper injury. Can you talk us through that, when you can actually get perhaps some of the penis or foreskin skin caught in a zipper?
Yes, so that's another very unfortunate injury. It's not that common, but we do still see it, and we definitely have very quick ways of dealing with it. If that happens, we want you to come straight in. That's another reason to come straight to the emergency department. Basically, it is just where the penis foreskin has become caught as a child is doing up their zipper. Very, very painful. And so usually when a child presents with this problem, they'll be seen pretty quickly, and we would give them some very strong pain relief. And there's different methods actually of removing that zipper that I won't go into today, but just to know that we can get the zippers off.
And don't try and remove it at home.
Do not try and remove it at home. Come and see us. We're very happy to see you in the emergency department. Yeah.
Fortunately rare.
Yes.
And obviously things that relate to the genitals can be a bit sensitive sometimes, Bec. Do you find that children or young people or their parents might perhaps have avoided the issue a little bit or delayed presenting sometimes to the emergency department?
It's a really good point. So I do like to think that in today's age that we are probably a little bit more across these sensitive topics, and I hope that parents feel comfortable to bring their children in if there is a genital issue for both boys and girls. But certainly there are things that we do in the emergency department to keep you comfortable. I wouldn't want anyone to ever feel like they were embarrassed to bring their child in. And for, younger kids, the parent will always stay with the child while we're examining them. And then for maybe the young adult, we leave it up to them if they'd like their parent in the room, or maybe the parent can step outside while we do that with a chaperone. So I think that, it can be a little bit embarrassing, but we try and, support you through that process. And we see this stuff all the time, so we're certainly not bothered by it at all.
Absolutely. We see everything, right?
Yes.
Well, that's been really helpful, Bec, to talk through some of those more common things that can crop up, and in particular just the regular day-to-day care that is required at home. And as you say, not sort of overdoing things when it comes to trying to retract the foreskin, to really avoid those situations where you might actually wind up in a bit of trouble. And for people who've got questions, they can have a look at our fact sheet, the penis and foreskin care, where we've gone into a bit more detail on many of these things. Thanks for joining us today.
Oh, thanks. It's been a pleasure.
Information in this podcast is general in nature and is intended to support, not replace, discussions with your doctor or healthcare professional. If you have concerns about your child, please consult your local healthcare professional for individual advice. This podcast is recorded on the traditional lands of the Wurundjeri people of the Kulin Nation, and we pay respects to their elders. Kids Health Info is funded thanks to the support of the Royal Children's Hospital Good Friday Appeal.